D Group's, an established entity since 1999, has solidified its presence in the South Asian region, in Andhra Pradesh, with Hyderabad as its capital. And Pan India Service. We specialize in occupational health center, OHC, services, comprehensive sales, and service of medical equipment, as well as offering cutting-edge leasing services.
Rental basis services. Recognizing the evolving needs of healthcare facilities, Groups offers innovative solutions through its rental basis services. Whether it's a short-term requirement for specific equipment or a strategic approach to managing capital expenditure, Groups ensures flexibility. And
X-rays are a form of electromagnetic radiation with wavelengths shorter than ultraviolet light. They were discovered by Wilhelm Conrad Röntgen, a German physicist, on November 8, 1895. Röntgen accidentally discovered X-rays while experimenting with cathode rays in a vacuum tube. Types of X-rays. Diagnostic X-rays, used for medical imaging to visualize the inside of the body. Therapeutic X-rays, used in radiation therapy to treat certain medical conditions, particularly cancer. Industrial X-rays, applied in non-destructive testing to inspect the integrity of materials and structures. Airport security scanners, use X-rays for security screening of luggage. Exposure levels. The amount of radiation exposure in the body depends on the type of X-ray and the specific imaging procedure. The unit of measurement for radiation exposure is the millisievert, MSV. Common X-ray exposures. Chest X-ray, 0.1 millisieverts. Dental X-ray, 0.005 to 0.01 millisieverts. CT scan, head, 2 millisieverts. CT scan, abdomen and pay, uses of X-rays. Medical diagnosis, detecting and diagnosing various medical conditions. Treatment, radiation therapy for cancer treatment. Industrial inspection, ensuring the integrity of materials and structures. Security screening, checking luggage at airports. Disadvantages and precautions. Disadvantages: overexposure to X-rays can potentially damage living tissues and increase the risk of cancer. Precautions: radiologists and technologists take measures to minimize radiation exposure, such as using lead aprons and collars, limiting the number of X-ray images taken, and ensuring proper equipment calibration. Cost and manufacturers. The cost of X-ray equipment varies depending on the type and complexity. Large medical X-ray machines can range from tens of thousands to several $1 million. Some well-known manufacturers of X-ray equipment include Siemens Healthineers, GE Healthcare, Philips Healthcare, and Toshiba Medical Systems, now part of Canon Medical Sci.
X-rays play a crucial role in the COVID-19 pandemic in several ways. Diagnostic tool: chest X-rays are commonly used to aid in the diagnosis of COVID-19, particularly in cases where access to other diagnostic tools like polymerase chain reaction (PCR) tests may be limited. The imaging helps identify characteristic patterns of pneumonia associated with the virus. Assessment of lung involvement: X-rays can provide valuable information about the extent of lung involvement in COVID-19 patients. They help healthcare professionals assess the severity of the disease and make decisions regarding appropriate treatment and patient management. Monitoring disease progression: follow-up X-rays are used to monitor the progression of the disease and evaluate the effectiveness of treatments. Changes in lung patterns seen on X-rays can inform healthcare providers about the evolving condition of the patient. Screening and triage: in some healthcare settings, X-rays are used for screening and triage purposes, helping healthcare providers quickly assess the lung status of individuals and prioritize those who may need urgent care. Research and data collection: X-ray imaging of COVID-19 cases contributes to research efforts aimed at understanding the disease's impact on the respiratory system. This data is valuable for improving treatment strategies and enhancing our overall understanding of the virus. It's important to note that while X-rays are valuable in certain aspects of COVID-19 management, they are not a standalone diagnostic tool, and a comprehensive approach combining clinical assessment, laboratory tests, and imaging is often employed for accurate diagnosis and patient care. Additionally, advancements in imaging technologies, such as portable X-ray devices, have proven particularly useful in managing COVID-19 cases, especially in situations where mobility and quick assessments.
We sincerely appreciate you taking the time to watch our content on Groups. Your support means the world to us, and we are thrilled to have you as part of our community. If you enjoyed what you saw, don't forget to hit that subscribe button. Subscribing ensures that you stay updated with our latest videos, updates, and exciting content. By subscribing, you become an integral part of our growing community, and your support inspires us to create more engaging and valuable content for you. Thank you for being a part of the Groups family. We look forward to bringing you more entertaining and informative content in the future. If you have any suggestions or topics you'd like us to cover, feel free to leave a comment below. Once again, thank you for your support, and we can't wait to share more exciting moments with you on Groups.